I am Kristen McClure, and I am a therapist who works with and specializes in support for ADHD women. I want to talk a little bit about this in my video today because October is ADHD Awareness Month. ADHD women's challenges are often very different from those of ADHD men and other ADHD groups. These are distinct because of various factors: cultural factors, social factors, and genetic factors. These unique issues include diagnoses. So ADHD women are often diagnosed late or they're misdiagnosed. That's because ADHD girls learn to hide or suppress their symptoms through masking, people pleasing, perfectionism, overcompensating. This can make ADHD harder to detect, and this can lead to delayed or misdiagnosis. Also, there are a lot of professionals who are not qualified, don't understand how to look for these signs. And the diagnostic criteria is poorly constructed and doesn't include what we know about ADHD women. So, symptoms such as inattentiveness, emotional dysregulation, and some other things like rejection sensitivity dysphoria, which is a unique kind of symptom we see, which is feeling criticized easily, feeling very sensitive to making mistakes. They're often misinterpreted. And some of the things that they're misinterpreted as or misdiagnosed as are anxiety, depression, borderline personality disorder, even bipolar disorder. There's also hormonal changes, which influence how ADHD manifests in ADHD women. During adolescence, pregnancy, and menopause, this further complicates the diagnostic process. So, emotional regulation and sensitivity is something that we really see in ADHD women. This is a big issue. ADHD women often struggle with managing emotions, which can result in them being labeled too sensitive or dramatic. And this intensity often results in these misdiagnoses, right? It can cause a lot of problems because this isn't in the diagnostic criteria. So this results in the labels of borderline personality disorder or bipolar disorder, or even in a lot of the struggles that ADHD women experience, this internalizing their experience. Rejection sensitivity dysphoria, again, not in the criteria. This heightened sensitivity to rejection, criticism, and perceived failures. We know this is common. Almost all ADHD women have it. It contributes to a lot of their anxiety, their self-doubt, and even imposter syndrome, which is another thing that ADHD women often struggle with. Societal expectations and gender roles. Women with ADHD often feel this pressure to adhere to gender roles, being organized, being nurturing, being emotionally regulated. These societal expectations cause immense stress for ADHD women who struggle with executive functioning, and this makes it really hard for them to perform at that expected level. Of course, it's hard for all women to perform at that expected level, but so these expectations, they lead to a lot of stress for ADHD women who are trying very hard to meet these expectations, and they'll really do anything to meet these expectations. Eventually, that leads to a lot of stress, lots of feelings of inadequacy, lots of damage to their sense of self, and burnout. This leads to something called neurodivergent burnout, which we'll have some videos on. In the workplace, women with ADHD often mask their symptoms to appear competent and organized at great personal cost. And this also contributes to exhaustion and burnout and this constant kind of suppression of who they are to appear on the outside, to appear very competent and very together. There's also this unique presentation of hyperactivity. So what is typically described as hyperactivity in the DSM, the manual we use to diagnose ADHD, in women is not it doesn't look like the typical physical hyperactivity that we see more often in boys or even men. In women, it looks more like this internal restlessness, racing thoughts, this inability to relax, this feeling of anxiety. Again, this leads to this mischaracterization, mislabeling as anxiety, and this misunderstanding by women themselves of what is going on with them. Lots of experiences of burnout and stress and physical illness, all kinds of physical illness, and the kinds of physical illnesses that women experience that don't have a lot of remedies, don't have a lot of medical expertise, don't have a lot of solutions in the medical profession. So things such as fibromyalgia, chronic fatigue, muscular skeletal issues, chronic pain issues. So lots of experiences of chronic stress lead to those issues, and there are not a lot of solutions for ADHD women, but huge, baffling correlations with these issues. And again, we'll talk about these in more detail in the days to come. Lots of responsibilities that are heaped upon women lead to late diagnosis in ADHD women. So as they move through life and accumulate more and more responsibilities, they will be more likely to hit that threshold where diagnosis becomes obvious. So caregiving responsibilities, more responsibilities in the workplace, bearing children, all of these things come with more and more stress and more executive functioning responsibilities and more hormonal transitions. And these things are more likely to bring ADHD to light, even in women who had subthreshold symptoms. And so we know all of these things can suddenly cause diagnosis to come to light and ADHD symptoms to exacerbate, because symptoms of ADHD in women are not consistent. They don't stay steady, and they will ebb and flow as a woman moves through her life, specifically as hormonal transitions happen. So estrogen modulates dopamine, and dopamine plays a huge role in ADHD. So every month with your cycle, as your estrogen ebbs and flows, so do your ADHD rates. And through pregnancy and after pregnancy, your estrogen will fluctuate, and so will your ADHD traits. Through perimenopause and menopause, often very vulnerable times for ADHD women, so too will your ADHD traits fluctuate. So these things are also really important to understand about women, and we're going to talk about all these things. And then finally, being undervalued as a neurodivergent person in this world and never understanding what your strengths are, never having your strengths capitalized on, and only having your weaknesses kind of focused on, leads to this imbalance in your body, this constant stress upon your body and your mind. And undervalued strengths, rather than having your strengths acknowledged and your strengths fed, is like a really big issue for ADHD women. So strengths like creativity and problem solving and empathy, these strengths are very often undervalued throughout your life in environments and a world that prioritizes structure and linear thinking and organization. And so women often feel like they are unknown, unnoticed, undervalued, and their unique strengths are just not recognized. So